therapy, when a person does the tapping, are they, can you explain, kind of tie that in, are they thinking about a particular event as far as how therapy is done?
Yeah, what we would do is we would ask you to think about the problem. If we're treating PTSD, I would say think about the event. And I'd say think about the worst part of the event. And sometimes if someone's visual, they'll come up with a picture in their mind. If they're kinesthetic, they're going to come up with a feeling. They may just remember a certain part of that. That's the worst. So when they have that memory, what happens is that then they become triggered if they have post-traumatic stress disorder. And that's because there's some disturbance in that thought field. The hallmarks of thought, let's back up for a second, just talk about post-traumatic stress, because I think it's important for people to understand what it really is. And the simplistic, well, it's not simplistic, probably the most direct way to understand it is that post-traumatic stress disorder is the inability of the body and the mind to discern the difference between the there and then and the here and now. So what happens is somebody who is actually diagnosed with post-traumatic stress disorder, as soon as they remember an event or when they're triggered to think about an event, their body and their mind can't tell that that's something that happened to them there and then, and that they're here and now thinking about it. Their body experiences it as it's happening here and now. And that causes the damage to the body, because then you get the same physiological changes happening in the body and the chemical changes happening in the mind that happened when the event happened. And that's destructive to the body and to the mind. So what we do with thought field therapy is we try to help the body to be able to discern the difference between the there and then and the here and now.